Hi, welcome to Chapter 2, McKernan's book. This chapter covers veterinary practice management. We're going to be going over the learning objectives. Again, I just want you to read through them and realize that this is what I'll be focusing on through the lecture. I'm going to talk about veterinary facilities first. So there are a lot of different hospitals, clinics, etc., that are available. Usually several within miles of your house. And you may have wondered what makes it a veterinary teaching hospital versus a veterinary hospital versus a veterinary clinic versus an animal clinic versus an outpatient clinic versus an office, veterinary office, or a mobile practice. There are also emergency facilities, on-call emergency service, specialty facilities, and referral facilities, and also there's something called a center. So there actually is a wide variety in the way that people name their facility, but there are recommendations that are made on how to name a facility, and those recommendations or those guidelines are in your book. If you look in Chapter 2, Box 1, there are some guidelines to name facilities. Now, I have an assignment for you, and that assignment is to find a veterinary facility nearby or on the web or someplace. Look at what they offer, match it up with the guidelines that you see in box 2.1 in your text, and see if it's named correctly. If it's named correctly, tell me why it's named correctly according to the guidelines. If it's not named correctly, tell me why it's not named correctly, and then maybe make a suggestion to how to name it a little bit more according to the guidelines. So look into that a little bit. That'll help you understand the differences between the facilities. Some employee positions that we see in veterinary hospitals would be management personnel, veterinarians, veterinary technicians and technologists, veterinary assistants, receptionists, and then kennel, ward, and barn attendants. Management personnel. So I have a symbol up at the top here. It's a CVPM. There's a certification as a veterinary practice manager that you can get. What that does is it helps to free the veterinarian to practice medicine so they don't have to practice running a business. The management could be called an office manager, a practice manager, or a hospital administrator. They are responsible for taking care of all the business functions of the practice, including budgets, purchasing, and marketing, supervisory and hiring duties, workflow and scheduling, making day-to-day management decisions to allow the practice to meet its stated goals, and developing a market plan for the practice. So if you like working with animals, but you really like the business aspect of the practice, this may be something that you want to look into. I have a video here. I'd like you to watch it before you come to class. If you go to your course shell and pull up the lecture that is just the lecture and download it, you should be able to click on this and play the video. Certified veterinary practice manager does. I also have a screenshot of a place where you can get certified as a veterinary practice manager, and this is typically an online program and something that you could do in your own time. Veterinarians. So we've talked about this before, but what do they do? They diagnose and treat ill or injured animals, and as a veterinarian, I can tell you that when we go to school for 4 years, we are tasked with learning about all species and all methods of treating, whether it's surgery or medicine or nursing care. We're trained in all aspects of that, dentistry, surgery, dermatology, neurology, anything that you can think of as a specialty that we see in human medicine. Veterinarians have all of that training. We provide preventive or wellness care, and that's actually my favorite part because preventing disease is the best way to keep animals healthy. Perform full physical examinations, and then assess herd health. So mostly that's large animal practitioners, but we also talk about herd health when we're talking about animals that are in shelter environments or in group environments. Veterinary technicians and technologists are responsible for evaluating and ameliorating the patient's reactions to disease. So ameliorating means to soften, to limit their reaction to the disease, so make them feel better. Assess and reassess the patient, develop and implement a nursing treatment plans of the veterinarian, alert the veterinarian to changes, educate the client. So a lot of work with the patient and with making sure that the patient gets the utmost in medical care and that you're communicating that to the client. Veterinary assistants perform animal care and ward maintenance. Duties may include animal restraint, lab work, prescription filling, preparing surgical patients, bathing animals and cleaning cages, feeding, watering, and walking patients. There are certain things that we've talked about that a veterinary technician can do, but a veterinary assistant cannot do. What I want you to do is you can click on this list. Let's see if I can pull that up. And I want you to look and see which 3 things can an animal aid or a veterinary assistant do with direct supervision of a veterinarian. And that is to remove sutures, drains, and staples, but a veterinarian must be there watching them. Can do venipuncture, so can take blood, but again, a veterinarian must be there watching them, and can also perform laser therapy. So those are the 3 things that veterinary assistants can do under direct supervision. There are several things that they can do with a veterinarian in the practice, and those include microchip, decapitate rabies for rabies test submission, clamp calves' tails, dock sheep and pigs' tails, trim normal hooves, necropsy, tissue sample collection, x-rays, getting data, patient data, etc. So I won't read down through these, but there are a lot of things that they can do with a veterinarian in the practice. But if you look over here, the veterinary technician can do far more, and there's a lot that is not permitted an animal aid to do at all, and that includes an IV catheter. So we're going to go back to our slideshow. So look through there and make sure you understand that. We talked about scope of practice last time, and I want you to understand what the scope of practice is for a veterinary technician versus a veterinary assistant. As a student in the program, when you're working as a student when you've been selected as in the cohort of the program, that's the 2nd year, that's the selective phase. There are things you are permitted to work as a veterinary technician with a little bit more supervision. So you're not really a veterinary assistant, you're not fully a veterinary technician, but you're kind of in between the two. The receptionist is so important in the veterinary practice. They are the friendly face in the reception area. Have to paste that smile on when you answer the phone, when you greet clients. You facilitate client service, organize appointments. You're the voice on the telephone. You're the first thing that people hear, the first face that people see. You handle fee payments, billings, and daily cash records. Super important to be the there's a personality that makes a great receptionist, and that's somebody who's open and friendly and just really likes helping people. One thing that I usually would tell my receptionists when I was training them is that you must answer a phone within 3 rings, and you must greet a client, either just make eye contact with a client within 3 seconds. 3 seconds. Otherwise, people think you're ignoring them. So 3 seconds, 3 rings. That's really important. Kennel ward and barn attendants. These people follow established protocols for cleaning and sanitizing cages, runs, exercise areas, and stalls. It's important to know that you are not typically responsible for establishing those protocols, but you do have to follow those rules. You are the first line of defense against nosocomial infections. Nosocomial infections, if you click that word, it'll take you to I believe it takes you to a definition, but those are infections that we give patients because we're not being clean enough, or it's something they picked up in the hospital. So we're not isolating sick patients, we're not being clean enough, and it's really important that we aren't the ones that give animals infections. We want to keep them from getting infected. So our kennel ward and barn attendants are in an important line of defense there. They're going to keep patients clean and comfortable, observe and record patient behavior, move patients from one area to another, but use those safety protocols. When we're moving patients within the hospital, we are going to be using 2 slip leashes, not just one, but 2 leashes on that pet at all times. A lot of times, kennel ward and barn attendants will double as assistants and start being cross-trained to be helpful with the medical team. So it's a good place to start. So everybody in the practice must assume some of the cleaning duties. It's a dirty business. It is definitely one of those dirty jobs. So it's everybody's job to remove animal hair. We can use central vacuum systems or regular vacuum systems. Just sweep, mop, throw things away. We need to monitor odors and sanitation. Nobody wants to walk into a nasty smelling veterinary hospital. It does not make you feel like your pet is getting the best care. Also, medical equipment cleaning. These pieces of equipment are thousands of dollars to maintain and thousands upon thousands of dollars to replace. So we want to make sure that everybody knows how to clean it, but we have usually 1 or 2 people that will be doing the monthly, weekly, or day-to-day maintenance on each machine. So general maintenance for the building, we want to make sure that the interior of the building, this is going to be your job if it isn't already. It's going to be your job as the one with the least experience in the clinic, whether you're a student or not. Do expect that you're going to be doing cleaning. That's an important part of your job. Floors, flat surfaces, walls, cages, runs, and stalls should be clean and odor-free. Cleaning is scheduled on a regular basis, but everyone needs to participate all the time in keeping the facility clean. So I want you to remember this. So if you are selected as somebody to participate in the clinical portion of this program, if you are selected, one of your you're going to be feeling really good about yourselves. But one of the things I'm going to encourage you to do is don't ever just stand there. If you're standing there and you don't feel like somebody's paying attention to you, or you don't have anything else to do, there's always something to clean. So pick something up, pick up a spray bottle and a cloth, and everyone's responsibility, because it is so important for the business to keep everything clean, for the health of the animals and for the health of the people working there and the health of the business. Practice facilities and work practices and different facilities will have different ways of doing business. These vary based on the needs of the clients and the species that are seen in the practice. Some states also have regulations regarding facilities and equipment. There is an AAHA, the American Animal Hospital Association accreditation service that developed a standard of veterinary excellence in how to run the best, all the best practices in running a veterinary hospital. You can get your hospital may already be AAHA accredited, or that you may want to take them to the place where they could be AAHA accredited. And there's just a long list of things that you need to make sure that you do in order to make sure you're doing best practices. When you see that AAHA accreditation seal of approval on the door of a veterinary clinic, you can be assured that they are doing things right. And that's why a lot of hospitals will go for accreditation. It's not mandatory and it's very difficult to get. But it is something that would be very beneficial for your hospital. This also, I have an example of who might see a doctor. If you have a 2-doctor practice, how often they're going to see a patient. Some doctors may take longer. Some may see more senior pets. Some may see more preventive care or puppy pets. Some may do surgeries while the other one is doing office visits. So it will change from hospital to hospital and day to day. For small animal general practices, the facility exterior should be clean, nicely landscaped and maintained, well lit, and have an adequate parking area, and the signs should be well maintained. If you come up to a veterinary clinic, whether you're there for the first time or you've been working there, or it's a place that you've been going to, take a look around. Look at the veterinary clinic. Think about what's there. If you're seeing trash in the parking lot, trash along the landscaping. Maybe something that you want to keep in mind that you either want to pick that up if you work there or say something to the clinic. They may not know that it's there. But it can make a huge difference. A first impression makes a huge difference in clients coming into your business. Outpatient areas. This is a very large one, but there is a reception area. We have examination rooms as part of the outpatient areas. Now we can take surgery animals or patients that are going to stay in the hospital for a while into an examination rooms, but usually those are reserved for people who are going to be coming in, having a brief visit, and leaving that same day. We also have a pharmacy that's a part of the outpatient area. It's usually in between the outpatient area and the treatment area. Laboratory, and then restrooms for our clients. Inpatient areas include the treatment area, which we can take outpatients to do treatment and then return them to the examination room as necessary. We also could have special procedure rooms for x-ray, ultrasound, and endoscopy. There will be patient wards where we keep dogs and cats, and often we like to have those separated because cats do not like to be in the same ward as those noisy dogs. An isolation ward for animals that may have a communicable disease. An exercise area, kitchen, boarding, bathing, and grooming areas, depending on what your facility does. Your facility may or may not do boarding. It's an example of a treatment area in a radiology room. In this treatment area, you can see that there are some other places that you can see into: intensive care, surgical suite, radiology. It's kind of a large one. And then in the radiology room, this is typically a room that is a little bit, we can turn the lights off, it could be a little bit darker, and usually just enough room for a couple of people in the radiology room. Surgical area, we will often have a preparation room or a prep area prior to going into the surgical area. That's a place where we can prep the patient, but also where we can clean instruments and prep them for sterilization. We'll have the operating room and then also a recovery room. The recovery room might be in the treatment area, but it's going to be someplace where we can keep an eye on those animals that are recovering. Support areas. These would be the back of the hospital. They would include professional offices, a business management office, the library, an employee lounge, and then storage or inventory areas. Now I have some pictures of some storage areas, and just to make the point that your storage inventory areas should be very clean and organized. So I have an example of one that's not clean and organized, and we have one that is very clean and organized. So you want to make sure that it's not a danger to anybody who's walking in and trying to get something off a shelf. There are other types of practices. There are mobile facilities. They're small animal mobile facilities, such as this van here, where you could bring the animal into the van and shut the doors and keep them confined. We also have large animal and specialty and emergency practices that have maybe a truck with just bins and shelves for different pieces of equipment, also a refrigerated unit for vaccines. There are specialty and emergency practices. The ones in this area are MedVet, which is on Dryden Road, and that has an emergency practice, plus there are specialty doctors that come and meet with clients during the day there. There's also the Care Center, which is on Clio and Bigger Road in Centerville, and that also is an emergency, 24-hour emergency practice and has specialists that come daily to meet with clients. So they're going to be larger, they're going to be more advanced, and they're going to be divided by department. They're going to look more like a human hospital. We could also have this large animal mobile unit, but also a haul-in facility where you would bring large animals. Moving from the facility to the base of the veterinary practice, which is the client. It is really important that you communicate with your clients very well. And we need to be aware that clients judge a practice based on client services, not the quality of medical care. You can be the worst doctor, worst tech in the world, and do the worst care on these pets, but if you are really good at providing service to your client and providing communication to your client, that's what they see. And that's a sad state of affairs, but that's what they see. So my challenge to you is to not only provide quality medical care, but also really good client service and good communication. These good communication skills can be learned. Now, some of you have probably worked on this a little bit. Written communication as well as verbal communication. Good communication brings efficiency. When we talk about good communication, we're talking about using proper medical terms because that brings efficiency, but also active listening. Active listening allows you to get on the same page a lot quicker. Here describes it. The 6 things you need to remember. You need to pay attention. You need to look at who is talking. Do not talk. That's one I have trouble with. I don't know about you. Ask questions, follow directions, and visualize what is being said. That's all part of active listening. The more you practice active listening in this class, the better you'll do in this class. And the same holds true throughout your career and your life. 6 aspects of excellent communication. So first of all, clarity. And I'm asking for examples here, and we'll talk about some examples when we go through this in our discussion. So clarity, being clear with the way that you communicate, and making sure that you understand the way that what somebody is asking or what somebody's telling you, and you can repeat back to them what you have heard them say and ask for clarity. Courtesy, just being polite. Positive nonverbal communication. That means that you're standing not in a aggressive manner. You don't have your arms crossed. You are making eye contact. You're smiling. That's all nonverbal communication. Open-ended inquiry, which is asking a question without a yes or no answer. One example would be, when was the last time your pet acted normal? And so the person actually has to go back and think about when the last time their pet was acting normally. You wouldn't want to ask something like, is your pet sick today? Okay, because that's a yes or no question. Reflective listening, which is when you repeat back what you are hearing. And then empathy. So showing empathy. Oh, I hear what you're saying. This sounds horrible. I hope that we can get your pet feeling better soon. Dealing with difficult clients. This happens at least once a day, and sometimes it happens several times a day. Those days where it happens several times a day can be really difficult to get through. When you have difficult clients, you want to invite an angry client into a private area so you can have an active listening experience. You want to create a friendly space. Try to sit side by side. Don't put anything between you. Start by thanking the client for sharing, because if they don't share information with you, you can't get better. You can't get your clinic better. So, it does, for some people, it takes a lot to get them to actually share that information. You want to let them complain completely. Stop talking. Allow full expression of the complaint. Let them talk. Oftentimes, by the time they get to the end of their complaint, they're done, and they just wanted to be listened to. You want to actively and reflectively listen to the complaint. So nod your head, say, yes, I understand. You want to sympathize, you want to empathize with the client. Again, when you get to the end of this, when the client has spent their anger, oftentimes they're then willing to listen, willing to discuss, and willing to work on something with you to help them to feel better. So we do have to seek that conflict resolution. Listen first to all of it and then respond. You want to find points of agreement. You don't want to justify a clinical action. If a client is correct, admit it and correct the problem immediately. You want to put necessary procedures in a positive light and seek a win-win solution. How are we going to make this work for everybody, especially the pet? And you want to let the client save face when possible. If you don't allow for that, you're not going to have a client for very long. Don't take the client's anger personally. This is really difficult for us to do. We're all empathetic people. That's why we like working with the animals. However, when we allow other people's energy to influence our own energy, it really makes us as empathetic people very hurt. And it's really important that we try not to do that. Remember that clients' anger is their own. It's their own, and there's nothing, they want to put it on you. They want you to take it. take it away from them, but it's their own anger. You want to take it away from them and just let it lie. You don't want to take it to you, okay? All right. We have a couple more slides to go through, but we're going to be covering this a lot later, and so I want you to stop, ask questions if you don't think these topics are covered well enough, but I'm going to go through these slides pretty quickly. So we are wanting you to understand the qualities of a good manager, identify key management roles, define a business plan. What is a business plan? Define what a human resources manager might do. Identify appropriate marketing material, data analysis, inventory management, computerized medical records. So management roles. Planning, human resources, marketing, financial, operations, facility, and equipment. Those are all part of management roles. Qualities of a good manager: they should develop the ability to conceptualize the veterinarian's vision and goals, because often it's the veterinarian who owns the business. Need to organize your area, be a productive team player, communicate well, and solve problems constructively. We do have to plan. We do our best to plan in a veterinary hospital business. We need to be strategic and operational. We need to make sure that we have the right number of people to help the right number of pets. We need to have the right amount of inventory to help those pets. And making sure that you have all that needs to be something that you can do strategically and be able to plan. So that comes with experience, but it also comes with a knowledge of how to run an efficient business. We need to adapt to enforce change, be able to adapt to enforce change. That happens all the time. We need to be able to anticipate future needs. You need to understand what a business plan is and how to create a business plan. I don't know if you've done this in high school before, but it's about developing what our business goals are and then how are we going to take steps to meet those goals. You need to understand monthly and annual budgets and do monthly revenue tracking, compliance measurement, because we have a lot of laws that we have to comply with, a lot of regulations, so we have to make sure we measure those things. And then medical record audits. We have to make sure we're keeping up with our medical records efficiently and effectively. A business plan describes the current nature of the business and then describes plans for the future, both short-term and long-term. These should cover all key areas of the business. So how do we want to run the business? How do we want to grow the business? We want to know the service to be offered, our facility and equipment, our veterinarians and support staff, management, current and projected financials, marketing strategy, competitor analysis, market analysis, operations plan, and expected sources of funding. Obviously, our sources of funding typically come from our clients. So we need to make sure that we know how we are going to get our clients to pay us. So this sounds like something you probably never wanted to do, never wanted to be a part of. But if you're part of a business, any business, there are parts of this that you have to be aware of, because if you don't run these things well, you won't get paid well. Human resources are responsible for hiring, compensation, training and orientation, employee management, retention, and addressing employee stress. That's what human resources do. What you need to understand is that employee management and retention is really important, because an employee that is well managed stays, and an employee that stays costs you less than trying to hire and orient new employees all the time. So hiring is really important. You need to hire the right person in order to be able to manage and train them well and meet their expectations. So you're going to start by analyzing the personnel requirements. Develop a job description, create an organization chart, develop interview questions, and advertise the position. What I would like for you to do is to develop a job description for your fake veterinary hospital, or if you work in a veterinary hospital, for your veterinary hospital, for an RVT. So your position title would be veterinary technician. You want to know who the person is going to be reporting to. So who will that RVT report to? Will it be you? Will it be the office manager? Will it be the head vet tech? You want to have the basic purpose or mission of the job, the principal responsibilities, their minimum education experience. Do you want them to be graduated from an accredited program and have their VT&E completed or be licensed already, have several years of experience, or are you expecting new graduates and you're going to be there to help train them to take their VT&E? You also need to have some ADA requirements. One of those must be able to lift at least 50 pounds and be dexterous with hands and able to see and hear with few with little support, something like that. The hiring process, you're going to review applicants and select interviews. So you're not going to interview every application that comes in. You're going to conduct those interviews. It does take time to do those properly. You have to be very careful when you're asking questions because there are certain questions that are discriminatory or illegal to ask. For instance, when you have a young lady come in who is obviously pregnant, you cannot ask, "When are you due?" That is discriminatory and illegal. So if you ask her when she is due to have a baby, and then you decide not to hire her based on the fact that she's going to be having a baby soon and want to go on maternity leave, that's discriminatory and you're not allowed to do that. You are going to then check references. You're going to select the candidate from interviewees. You're going to make the offer with the salary and then select a start day and day of orientation. For employee stress, you need to strategically identify these stressors, look for mental and physical signs, and find ways to reduce stress in the workplace. We use a lot of humor in our veterinary practices. We use little games. We use little things that we can do, little strategies that work with certain people. Not everybody will benefit from this, but we try to find ways to reduce stress in the workplace. Substance abuse is a problem everywhere, and it can be a significant problem within the workplace. So we don't want to create an environment in which substance abuse is celebrated. We don't want to create an environment where it is it's made easy for somebody to abuse substances. So we want to keep controlled substances locked away, make sure that our logs are monitored, and we also want to make sure that we are allowing people who don't want to participate in drinking or self-medication or whatever substance that they're addicted to. We want to create that safe space where that's not something that they have to think about or work around. Okay. Marketing. Marketing is about obtaining clients and retaining clients. Most veterinary practices do a great job of retaining clients once they get them, and most clients are within 5 miles of the practice. And so obtaining clients is typically a drive-by situation. So that's part of the reason it's a good idea to have everything clean. So we're going to obtain clients, retain clients, enhance community awareness and standing, and we do internal versus external marketing. We focus on our client base. External marketing would focus on attracting new clients, and most veterinary hospitals actually don't do that. There are some do, and at this point we see a lot of social media marketing more than anything else, just creating awareness. For internal marketing, we look for maintaining the practice appearance and appeal, so making sure everything looks good for those clients that are already coming in. Making sure we're doing reminders, sympathy cards, and thank you notes. Providing full service practice so that every time they come in, they get what they need. Having training materials that are available to clients so that they can educate themselves, have different programs that are available to clients because clients do like to learn about their pets, have some professional sales point displays to sell over-the-counter material, and then other animal-related material available. We can do external marketing through advertising, newspaper, radio and television, community activities, web-based marketing, and pet portals. And I'm seeing a lot more of these web-based marketing social media campaigns. That's where everybody is these days. Financial management has to do with bookkeeping and accounting. And I know you're probably in this field to stay away from bookkeeping and accounting, but it's a really important part of making sure you get paid correctly. Management and analysis, making sure that everything is working efficiently. Budgeting, price setting. We need to know how much to charge for each medication we sell or over-the-counter products that we sell. Capital acquisition. Do we want to purchase an ultrasound machine this year? Because that's going to increase the service that we can provide, but then we're going to have to do training for that. So there's a lot of things to keep in mind. Risk management and then compliance with laws and regulations. Lots of things to think about. So with bookkeeping and accounting, we have a balance sheet, we have assets and liabilities, we have inventory levels. Important to keep in mind. Our income statements, we look at P&Ls or profit and loss statements. We're looking at these profit and loss statements for performance between 2 points in time. Typically they're monthly, could be quarterly, could be yearly. We're looking at the gross revenue total and our expenses incurred. We're going to decrease expenses and increase revenue, and that's the best way to get everybody paid what they want. And the other thing we'll look at is the statement of cash flows. A management analysis will give us a profitability calculation, so it tells us how profitable we are. We're looking for key performance indicators, identifying areas for improvement, collecting practice data. So data is really, really important, so we can compare it with other industries, other veterinary practices in the industry. We want to identify strategies to affect change. So if we don't feel like we're doing well in an area, we're not doing enough dental cleanings, because those are really good ways to make money for the practice. Doesn't take a lot of, it takes labor versus a lot of materials to do. So how do we do more dentals to increase our profit margin? We might do more education on why it's important to do dentals. Implementing new systems and then measuring results and then modifying our systems. Operations, the front desk and scheduling appointments. Scheduling appointments so that you are not running your team, your medical team ragged, but you're keeping them busy all the time. Making sure that we have estimates and client payments. Getting payments is really important. If you do payment plans, which a lot of veterinary hospitals don't do anymore because we have found that people don't choose to pay those, but you need to have a way to keep track of those payment plans. We need to be able to communicate effectively on cost of care and client financials options, as well as doing inventory management to make sure we have what we need on the shelf without over ordering. So we want to pet food, surgical, radiologic, and laboratory supplies. It's a balancing act between too much and too little. We need to perform weekly shelf counts and check invoices against items received and paid for, and replace drugs every 30 days. There's a 30-day cycle to make sure that we've got enough for 30 days of sales, and then essentially all new stuff every 30 days. There are things like inventory control systems. You can have a handwritten one, but it's a lot easier to use a computer one. Very easy. Ensures that all medications and supplies are available when needed, and it reduces your expenses by achieving a turnover rate of 8 to 12 times per year. It signals to the person who's doing the ordering when each item needs to be reordered, and then tracks orders received and back ordered stuff. It does rely on proper data entry. That means that if you sell something, you need to mark it in the computer so that you know that you need to replace it. This also helps you to track seasonal variations so you can anticipate what you need to order in the future. Inventory control system tracks past usage rates, provides purchase cost information, accounts for when and where items are used, and ensures proper monitoring and handling of DEA controlled substances. Identifies expired or outdated items for removal, and it enables the manager to detect theft. So they're all good things there. We are trying to move towards computerization of the veterinary practice. We have a practice information management system, or PIMS. It's kind of like our learning management system, like eLearn, that allows us to do electronic medical records, helps with patient scheduling, reminders, setting out automatic reminders, doing invoicing and accounts receivable, inventory, client communication, and operational analysis. Electronic medical records are, most practices have moved to it. It really improves our communication and efficiency within the healthcare team. This is an example of an appointment schedule in a PIM, Practice Information Management System. And we have our doctors across here, who they're seeing, what they're seeing, who they're working with, and we have somebody doing tech appointments as well. If you have any questions, please write them down and let's discuss them when we get together in class.